All right, hey guys, I'm Craig. This is my first semester at Valencia. I actually work at Orlando Health. I'm an exercise physiologist there. I work in cardiac rehab. So anybody who's had bypass surgery, valve surgery, heart transplants, I work with them. And the reason I'm going back to Valencia is I'm actually coming to get my nursing degree because my company's actually paying for it. So I said, hey, why not go back to school? So that's what I'm doing.
Cool. I guess I'll go next. My name's Isabella. Hopefully, I only have until spring, and I should move into UF pharmacy school. I'm going for pharmacy. I was working in the pharmacy at Publix, but now I'm doing dog sitting, so I could like focus more on school. And yeah.
So my name is Nicole, and I just started my first semester here at Valencia. My story is really long. I went to UCF, graduated, and now I'm back to community college because I want to do sonography this time. So I'm trying to do that.
Okay, I'm Amanda. I am a sophomore at Valencia. My goal is to get into the UCF nursing program right now. And before COVID, I was working as a lifeguard at Discovery Cove. And after COVID, I'm currently not working, just focusing on school.
Cool. Okay, so I did my presentation on osteoporosis, and what that is it's basically a condition that's defined as like low bone mineral density. And I'm gonna pull up my presentation here. Um, so osteoporosis is basically like on the right, you can see that. Can you guys see this picture?
Mm-hmm.
Yes.
Okay, so on the right, you can see that like the bone mineral density is not that it is in the left bone. And this process typically happens with aging. There's obviously lifestyle and genetic factors that go into osteoporosis. Obviously, we can't change the genetic risk factors, but some of the lifestyle factors we can change are alcohol, low physical activity, um, and low calcium intake can all have a big effect on the progression of osteoporosis. Um, One of the things that you can do to actually prevent osteoporosis from a young age is with a supplementation of calcium and vitamin D, and also participating in weight bearing exercises. We see as we get older that hip fractures and bone fractures are much more common, and osteoporosis is one of those leading factors on why older people tend to break more bones. Um, it's typically because of osteoporosis and this low mineral density. Some interventions that can be done are these things called bisphosphonates, and it's an injection, and it's a quite complicated injection. But as we learned back in Unit 3, how bones form from a young age, they go from the osteocytes to the osteoblasts, and then eventually, grow into the bone cells that we have. And these bisphosphonates actually inhibit the osteoclast function. And what that is it resorbs the bone, which we actually need when we're growing to, help shape the bone so that it's able to grow healthy. And so these bisphosphonates can actually reduce fractures up to 40%, because they inhibit this osteoclast that as we age, this osteoclast is still working, even though the osteoblasts aren't growing new bone. So that's one of the things that the bisphosphonates help inhibit the bone resorption. Okay. So Isabella, I'll make you the host now.
Okay. Give me 1 second. My computer's so slow. Hold on, sorry. Hold on. Maybe if someone else wants to start first, because it's actually taking a second to open. I'm so sorry.
I could go next if you want.
So, Isabella, I think you'll have to make Nicole the host now.
Oh. How do I do that? I don't know how to.
So go up to her name in the top right corner, and then select more, and then you can.
There we go.
Okay. So my topic is on PCOS, which is polycystic ovarian syndrome. And the way that it relates to what we're learning today is it's affecting our endocrine system. I want to share the PowerPoint that I have. Can you guys see that?
Mm-hmm. Yep.
I don't want to see my face. Sorry. Okay, so PCOS, PCOS is a hormonal imbalance disorder, which is common among women of the reproductive age. So the cause is unknown, but there has been some hereditary components that are at play. With PCOS, there is no cure, but it can be manageable through medication, diet, and exercise. So as I said, the PCOS is affecting the endocrine system, and a little summary is that the endocrine system produces hormones that regulate metabolism, growth, and development, tissue function, sexual function, reproduction, sleep, and mood, and among other things. And the two organs that we want to focus on is the pancreas and the ovaries. I don't know if you can see the picture on the right-hand side. So with the pancreas, as we all know that it's considered as part of the endocrine system and the digestive system, but with this, we'll focus on the endocrine side. So the function of the pancreas is to produce the hormone insulin, and its function is to reduce the glucose levels located in the bloodstream. So with women with PCOS, you'll find that they have a higher insulin level, which can cause the pancreas not to handle that much insulin, which that overproduction of insulin will move on to other organs, which will be the ovaries, and the ovaries houses the sex hormones. So my article, I found that they were trying to see whether or not supplementing vitamin D to PCOS patients will help with enhancing insulin synthesis. It's thought that vitamin D deficiency being prevalent among PCOS patients, that vitamin D can aid in insulin synthesis by enhancing insulin expression. So some of the methods that the doctor used is they had 180 women who had PCOS participate in the clinical trial. It went over for like 24 weeks. And Trumer's baseline was to measure vitamin D deficiency that was below 75 mmol over liters. I think that's what it is. The conclusion that he found was that there was no significant effects enough to prove that that their hypothesis that vitamin D deficiency affects the enhancing of insulin synthesis. So Trumer did find, though, that vitamin D supplementation does cause a reduction in plasma glucose. For my drug and intervention analysis, I found that metformin helps with the insulin resistance that happens within PCOS patients. Metformin is also commonly used to treat patients with type 2 diabetes. The studies have found that metformin is proven to be a great first line of treatment for PCOS patients. They'll be giving it to them orally, and they'll start off with 500 milligrams daily with a meal. One of the things that you should look out for metformin is that it does increase ovulation. So if you aren't planning to get pregnant at this moment, metformin would not be a good choice for you. And this is just a little diagram of like PCOS symptoms. So ladies in the chat, or ladies that you know in your family, if you see that they have these types of symptoms, then it could be an indicator of PCOS. 3 of the most common things that you should look for is hair loss, irregular periods, and your lab work. So if you see a high testosterone levels, that could be a sign of PCOS. That's all I have. Oh, do I have to host somebody?
Yeah, so you have to go to the top right and just click on either Amanda or Isabella, whoever wants to go next.
Okay, perfect.
Unmute yourself, Amanda.
Sorry. I just will be on because I'm on my phone because my computer Zoom doesn't like to work, so I'm not going to be screen sharing for mine.
It's my turn, right? Or who's the host? Me?
Yeah.
Okay, all right. I don't have anything to screen share, so I'll just talk about it. Alrighty, so mine's on scoliosis. What scoliosis is? Give me 1 second. Where did it go? It keeps disappearing. Okay, hold on. There we go. Okay, so I did mine on scoliosis. What's scoliosis? Why is it saying this? Oh my gosh, I'm so sorry. Okay, scoliosis is a condition in which the spine has an irregular lateral curvature. It's typically diagnosed in early childhood. There's many different types. There's some that if your spine is up to 25 to 40 degree curve, a doctor may recommend having surgery. It is also more prone in females rather than males. It does worsen. It may worsen when as you start developing even more to an older adult. It does. In the observation of one of the study articles saying that to help, because there's no solution to stop it besides if you get surgery, but without surgery, you would have to have back braces that can often help. The earlier you find treatment, the better to avoid further complications. What else? And then also for my drug and intervention analysis, monitoring it is pretty much what is going to be the basics, having a brace, physical therapy, and then worst comes to worst is surgery in the spine. The early symptoms is called the Cobb angle. The number of growth years remaining are all risk factors for development in scoliosis. A doctor would normally do checkup with a person who has a curve of 10 to 25 degrees every 3, 6, or 12 months, just to see if the conditions are improving or worsening. For the medical devices they would use on the spine would be rods, screws, and hooks to help straighten it up. But doctors really try to avoid having surgery due to they can have nerve injury, respiratory issues, and heart complications, and infections are all the possible side effects for the spinal surgery. And there's no medication that can treat scoliosis other than just like pain relievers like ibuprofen, Tylenol, anything that's for inflammatory. And if worse comes to worse, they would also prescribe opiates such as tramadol to help that severe pain. But the only thing with those medications, it may cause nausea, stomach pain, dizziness, and also a risk of addiction with being prescribed opiates. And that's my presentation.
Okay, so I guess I'll go.
I do have to make it
Um,
host. Make host.
Yeah.
There we go.
Okay. So I did my presentation on the clavicle fracture, which is when there's a break in the bone connecting to your breastbone and your shoulder, your clavicle bone. I did my report on this because it is a super common fracture, and it is the fracture that is most commonly found in children. So I've had a lot of people I know experience this, especially in sports. In most cases, clavicle fractures result from a direct fall onto your lateral shoulder. In the less common cases, it results from a direct trauma to your clavicle. There are two types of treatments for this fracture. In a mid-shaft clavicle fracture, you're going to be using a supportive treatment, which is the placement of a sling. And then in reductive treatment, that's going to be a figure of 8 brace. In the distal clavicle fracture, though, you want to keep away from the figure 8 brace as much as possible because it could increase the displacement of the fracture. And then for the healing process, in most patients, there's not really much of a worry in the healing process, just your normal sling and pain medication. In the defective healing cases, though, that's when they're going to have to go in with surgery and add screws and stuff like that. And there's usually, with this injury, there's usually 2 to 4 months of rehabilitation to return to your full normal self, including sports and other activities. And then for drugs, there's not really much you use besides your normal over-the-counter pain medications like Advil or ibuprofen. If the pain is really bad, they could prescribe you tramadol, but they want to stay away from that as much as possible because it could run the risk of you getting addicted. And yeah, but besides physical therapy, there's minimal pain, sometimes nausea, headache, dizziness, but sleep it off and you'll eventually be okay for most of the time. So yeah, that's what I got.
Okay. So Nicole, I had a question about yours. So you mentioned the study about the role in vitamin D supplementation.
Mhm.
Why do you think that they chose vitamin D supplementation versus some versus like a different type of mineral deficiency? Obviously, there was the overproduction in insulin,
Yeah.
which metformin is probably the most common diabetic medication in the world. So
Mhm.
I can see why they would prescribe that to help lower the insulin. But I'm not sure why they would do a study on vitamin D um, insufficiencies.
So what I read was that Trumer, who was the person that conducted this clinical trial, he saw that there was a correlation between vitamin D deficiency being prevalent in PCOS patients. And they wanted to see if that could help somehow increase the insulin receptors expression, because in PCOS, there's insulin resistance. And what insulin resistance is that there's like an over accumulation of insulin. So that will cause your pancreas to make more insulin, which will then start to target your ovaries and impair ovulation. And Trumer saw that, wanted to see if vitamin D can help with insulin resistance. But they didn't find anything conclusive on that.
Well, thank you.
Mhm. I have a question for Isabella.
Yes.
I don't know if you answered this, but can scoliosis be curable with surgery, or do the rods need to be replaced every couple of years?
Yes, it would be cured, because that is, the surgery, so it's gonna stay there now. But it doesn't get worse over time. So, and the rods will stay there. Everything should be fine unless there is an infection, or worse comes to worse, if something goes bad within the procedure, then they would have to take it out and then redo the whole thing, but that would be because of the surgeon.
Okay.
I do have a question for Amanda. I was thinking, what would be the fastest way to heal those fractures?
So it usually just depends on which healing process they want you to do, but the quickest way is just for the normal, like the most sorry, I'm sorry, I'm really trying right now. For the supportive treatments, that's going to be the quickest way it'll heal, and that's with the sling and just over-the-counter pain medications. Sometimes a little slow encouraged movement during the healing process, so maybe physical therapy as well, but not pushing yourself further you can go. So, and then for Craig, I have a question for you. You said interventions included a complicated injection. Do you know if there's any supplements people could take if they're already seeing signs of this?
Yeah, so some supplements that you could take would be calcium. Calcium's bone is 99% calcium. And another thing that's important with supplementing with calcium is you also need to supplement with vitamin D, because vitamin D actually helps with the absorption of calcium. So if you were to take, I don't know, like a bunch of calcium supplements and you weren't intaking any vitamin D, that calcium is actually just going to be, it's not going to be absorbed through your small intestine. You need that vitamin D to help with that absorption.
Right.
Perfect.
Okay, good job, you guys.
All right, perfect. And then does one person submit it, or yeah, I think